If you are part of the people that believe Carlos Lopez was the one responsible for what happened to Diana, you're going to want to hear this. I've been reviewing the lawsuit that Carlos Lopez has submitted in behalf of Diana and Carlitos to Doctors Hospital at Renaissance and also to RGV Med, which is a limited liability company. It's been very overwhelming. It's very detailed and just it's overwhelming to know what Diana went through, what the baby went through, and what Carlos had to witness. So it is on behalf of Diana and Carlos, and it is said that he's doing it as a next friend, which in legal terms it means that he's doing it on behalf of them. He's not a party to the lawsuit. He's just doing it because they can't represent themselves. In this case, Carlitos is a baby and Diana is an incompetent person at this time. So he's bringing this case forward. The case number is C-5366-24-L. The first sections talk about the hospital, the county. So where it really starts is on section 4, and this is how it goes. So Diana went to the hospital at 4 because initially she had gone to her doctor's appointment, and her doctor said, you know what, go to the hospital, get yourself checked in. You would need to be there for 24 hours under observation, given that she had symptoms or she was, it was for preeclampsia. So she went to the hospital as directed by her doctor. She got there at 4, but she wasn't admitted until 8 o'clock. At 8:49, a physical was done, where they check everything. They check how you are before admitting you fully into the hospital. They have to check how you are, your vitals, your breathing, your everything, right? So she was checked. Everything was normal. She was good. She wasn't under any stress, when she checked in. So she was good, right? So she got everything done. Everything was normal. The doctor prescribed medication, which is dexamethasone, and that is to help the baby develop his lungs. Doctors do this when they believe that she might be delivering within the next 7 days or so. So they do that to sort of speed up the process of development of the baby. She was also given nifedipine for her blood pressure and magnesium sulfate to prevent any maternal seizures that can be caused by, everything that she had going on. At 10:36, she was doing fine. She was checked by a nurse that was appointed to her that needed to monitor her. So at 10:36, a little over about 2 hours later, she was still doing fine. Then she started to become unstable. She was feeling discomfort when she was laying down. Her oxygen levels were decreasing. She was just very uncomfortable. At 11:25, a nurse came in and checked her blood. Because she was given magnesium sulfate, there are levels that if the body is at certain levels at magnesium, it can affect the body or the organs or anything. I'm going to post a picture of it. So those are the levels of magnesium that can cause damage or, serious side effects to the human body. Well, at 11:25, the nurse checked her blood and she did note that her magnesium levels were high. 12:30, she was given another drug so her blood pressure can reduce. And it was, to help her. She had high blood pressure, so they were, okay, give her this medication to lower her high blood pressure. At 1:09 a.m., Diana started feeling more discomfort. It was increasing. Her oxygen level was now below the 90s. By 1:30, it was more than evident that Diana was just very uncomfortable. It was very concerning at this point because she continued to ask to be sit down, and she couldn't breathe, and she wanted to be sitting down, and they were just sort of telling, like, you need to lie down to adjust your monitor. but she couldn't breathe if she was laying down. At 1:56 a.m., she was given an oxygen mask, and the oxygen level that they put there was the highest one. It was at 100%. She was also placed on a high Fowler's position, and let me put a picture of what a high Fowler is. So that's what the nurses put her on, because she was complaining she couldn't breathe when she was laying down, so they put her in that position. But nothing that they were doing was helping Deanna. They were not helping her feel better or even get better. And despite this, the rapid response team nor her physician were contacted or were advised of what was going on. The rapid response team, let me just educate what this is. This is when a patient is demonstrating signs of imminent clinical deterioration, or that she's not progressing. She's, clinical status is decreasing instead of making any progress. So when this is going on, this team is summoned to go to her bed or to her room immediately, so they can begin to assess and treat the patient to prevent for them to go to the intensive care unit, for them to have a cardiac arrest or unaliving. They were not called. 2:04 a.m., Deanna's primary nurse was notified about her low blood oxygen readings. 2:19, Deanna's blood oxygen saturation was continuing to dip below the 90s, and her heart rate was now increasing above 120. She was experiencing a lot of anxiety. I mean, you couldn't breathe. She can't breathe. She's pregnant with her baby, and she's going on. She's experiencing anxiety. Yes, of course, her heart rate was above the 120. 2:34, the nurse attempted to change Deanna for positions. The nurses were trying to get her to feel comfortable or to get her to breathe better, and it wasn't working. They even attempted the high Fowler's position again, and it didn't work. I mean, it didn't work the first time, but okay. Nothing worked, but then the rapid response team nor her physicians were contacted. Again, this is their second opportunity that they should have contacted them, and they didn't. 2:59 a.m., Deanna's now complaining of severe shortness of breath, and even though she was sitting up, and now her breathing was labored. An assessment of her lungs revealed that she had crackles and an abnormal sound that usually is heard when there's fluid in the lungs. That is why she couldn't breathe, because she had fluid on her lungs. That's why she couldn't breathe when she was laying down. 2:59 a.m., the nurse decided to discontinue the magnesium sulfate IV. And she ordered for the magnesium to be checked once again. I'm not a nurse, but on the research that I've been doing to understand everything, as soon as I saw the magnesium levels and the different levels that there is, and at 11:25, when the nurse checked that her magnesium levels were high, the magnesium should have been discontinued since then, since 11:25. That's a personal opinion, not a medical opinion. But I'm just, correct me if I'm wrong, anybody out there in the medical field. But they didn't discontinue this until 2:59 a.m. 3:06, a modified early warning score alert was given. The rapid response team finally arrived, but this time, Deanna was already in extremis, which is her life was literally at risk. She had pulmonary edema, which is a condition caused by too much fluid in her lungs, making it difficult for her to breathe. In most cases, heart problems can cause this, or even medications can cause this. She was also under respiratory distress and hypoxia, which is the inability for the heart to generate sufficient force for a contraction to be made, which led to pulseless activity, electrical activity. And this is also a form of a cardiac arrest, in which the electrodiagram shows that the heart rhythm should be, but it's not producing that pulse. That means that she coded, guys. They provided advanced cardiac life support by 3:31 because her heart had officially stopped. So they began chest compressions. I'm going to unfortunately have to do a part 2 in this.